would education change if we treated educator wellness as essential to student achievement? At Professional Inspiration, we believe educator and student wellness isn't optional, it's foundational. Our online courses, nationally accredited, are designed to inspire and empower and inform educators because when educators are well, students thrive. Explore our courses at professional-inspiration.com. Stay well.
Welcome back to Questions You Didn't Ask. I'm Niasha, joined once again by Dr. Paul Fleming. We're in the home stretch of Beyond the Band-Aid, prevention, power, and public health equity. And I can promise you, this conversation keeps hitting new highs. Let's dive right back in. So, back to our hashtag. So I think that it's really important that we are in a time where people are anxious for action. And I appreciate the fact that you are talking about how we need to free up our mind. You know, the way that things have been is not the way things are going to get better in the future. We have to imagine something different because the status quo has not served us, right? It's not served the majority of us. And even those who think that they are like living in ease, there's certain aspects of this world where you are not going to be able to escape the impacts, right, of your privilege.
Yeah.
And so I think that we are definitely in a space where we need to be about how. We need to be in the how. How do we move forward? So your book encourages a shift from tweaking systems, which has tended to be the approach that has won in a lot of examples. You've said, let's shift from tweaking systems to imagining entirely new ones. So how would you say that might look or play out when we think about, you mentioned the criminal justice system, we can relate to that, right?
Yeah.
We also talked a little bit about our educational experiences. How do you think this prevention thinking and kind of rehauling, if you will, plays itself out in any of those types of?
Yeah. So, and I also want to say, I think the tweaking of systems we've seen for decades where we'll make little policy switches around the edges, right? Even Obamacare, which made some pretty big changes to our healthcare system, it was a tweak, right? At the end of the day, we still had our patchwork system that left a lot of people struggling. Right now, with Trump, what we're seeing is some smashing of systems. And I think what I'd like to definitely say is that's not what I'm advocating for either. So tearing down systems, that may be a precursor to building systems we need. So if I allow myself to be hopeful, there is a way in which what we're experiencing right now may be a precursor to us being able to build the systems that we need once they're torn down. But of course, it's being done in such a reckless way that's not what I would advocate for. But the point being is that we do need to dream up new systems, right? There's a lot of things in our society that are built over time, right? And if you and I got together, and this would actually be really fun to do sometime, Niasha, if we got together with a whiteboard and we were like, all right, let's start a new country. What do we want? How are we going to make sure that people do share? What are we going to do with people if they make a mistake? If they do something that is somewhat harmful to another person? What kind of system do we want to put in place for that, right? The first thing we're probably not going to say is, oh, I have an idea. Let's put a bunch of people with guns in our community and make it so that they can't really have any accountability. And those people can lock people in cages, or at least start people on the process to that. That's not what we're going to dream for our new country, right? What we're going to think about is what systems are going to help everybody thrive. And if you take that prevention thinking approach, right, and you think about root causes, so why, and I'll focus in this area of sort of criminal justice, why are people stealing in the first place? Why are people acting violently in the first place? So if we dig into those root causes, we're going to identify some different issues. If it's stealing, maybe it's connected to poverty or not having resources or not having opportunities. There's a variety of things that could be connected to, but it's not just that the person who stole is a bad person,
right?
Which is what our criminal justice system kind of imagines, and our news media also imagines, right? You're a felon. You're labeled. You are not. It's not your behavior was bad. It's that this person is bad. And so, anyways, so you're digging to the root causes. With violence, it may have other root causes. May have learned it from family growing up. Whatever it is, right? So we want to create systems that prevent that from happening in the first place. Right now, our systems, right, are set up that, this person committed an act of violence. Now let's step in. Right. Now let's channel all of our expensive resources, because the police are very expensive and jail is very expensive. Let's channel all of our resources to addressing
punishing them.
Yeah. What if we marshaled all of those resources to preventing it in the first place? Right. And that's that prevention thinking. And so, I can think of, first off, if you're thinking about reorienting criminal justice resources, I'm thinking a lot about how do we put funding into schools to help social emotional learning, help give young people the tools that they need. Why aren't there widespread free classes for parents on how to be better parents? I certainly could use it.
Okay. Or just mental health around being a parent.
Yes, exactly. Widespread mental health resources, right? We could channel so much of what we put into our criminal legal system, policing, prisons. We could channel it into improving mental health in our communities, giving people the better tools to deal with conflict, right? We, as a society, we're pretty bad at dealing with conflict in a nonviolent way. And conflict is a natural part of being in human relationships.
Right.
And so, anyways, that's that prevention thinking, and that's that reorientation. And to answer your question, I first went to the place of like dreaming big, right? There are also some maybe less lofty, although I still want to work towards that vision, right? I'm not losing that vision, but in the immediate sort of shorter term, next couple of years, I think about building systems like emergency response systems that are disconnected from the police, right? So if you have an emergency at your home, or you're out and about and you have an emergency, in most of the US, the only resource you have is you call 911 and a police officer with a gun and the ability to arrest, detain, and send you to court and jail. That is the person who responds. If we were to build a system that had a more care first approach, that sent a social worker to arrive on the scene, who had conflict de-escalation skills, right? Had the ability to refer you to mental health services or housing services or whatever services you might need, right? That is the type of system that we need to be standing up in our communities as an alternative to police. And that creates alternative pathways, right? Because if you think about the unhoused person that, let's just say, is causing a mild disturbance on a city street, right? There are any number of ways a society could deal with that. But right now, we mostly deal with it by calling the police, and the police show up. Now, there are some officers that are very kind and they try to help that person, right? But that is not actually what police officers are trained to do. And that's not what they're hired to do, right?
Nope.
And our cities and our society is actually asking police officers to take on this role that sometimes leads to violence and arrests and imprisonment, right? So it's set up for disaster there, right?
Yes.
In that case, when the police show on the scene, you know, there's a decent chance that a good outcome will come of it. Maybe that person will get connected to the shelter, but there's also a decent chance that that person ends up in jail for the night, that that person ends up even worse, right? Getting harmed by the police officer. And so a care first approach would have us with somebody who is actually equipped to help that person get the resources that they need. And not just for that moment in time,
Right.
but how do we connect them with social services or the health services they need so they can get on a path to housing, to stability, et cetera. And so that's the type of systems that I think prevention thinking allows us to think about, dream up, and then take action on, right? Because once we have a vision and a clear idea of it, we can start advocating for it. We can start talking to our city council people and saying, why don't we have this? Why is it that my only choice is police in this moment, right? And there are some wonderful examples across the country of these programs sprouting up. I know Durham, North Carolina has a program. Denver has a program. There's other spots. So they are growing in frequency, but they're still not widespread. And even the ones that exist, there's some of them are going through some growing pains. You know, they're new, so they need to figure things out for how to operate. But that's the kind of thinking, you know, the book invites us to do together.
If you're enjoying the show as much as we love creating it, consider showing your support by buying us a cup of coffee. Visit buymeacoffee.com/Niasha Frey O. That's buymeacoffee.com/Niasha Frey O. All one word. Each cup is just $5, and every single one helps us continue to produce, develop, and sustain the high quality content you've come to expect from Questions You Didn't Ask. Thank you for your continued support, and let's keep the conversation going. I love it so much. I love it so much because everything that you were sharing, you know, I either have a personal, family, community example of, and I'll give two. One is a woman who has a business. She happens to own some land. She lives there, right? She's developing this amazing healing community, right? And it's associated with land and nature and all this other great stuff. And she had a disturbance with a family member who was going through a particular health crisis. And the response was the police showing up. These two people are of color, so it's concerning, right?
Yeah.
You don't know what you're going to get. Happen to get some really nice police officers, but there were several of them. Lights on, everything flashing and blaring. Now she's talking to them. They've de-escalated the situation. They understand what's going on. No one's going to jail. Woohoo! We win, right? And so then they start asking her questions, right? Because they are human beings. They're curious about the healing work that she's embarking on with this land. She said, I would love to tell you more and spend some time with you, but you're going to have to come back when you don't have that uniform on because my neighbors are watching. And if I'm going to be a business, I can't be having the police around here with their lights on, right? You're very nice people. I appreciate you. And the good thing is that, you know, they exchanged information and everything went smoothly. That's not the story that we usually get in the media. But the fact that there could have been a better way, a better time for her to meet those lovely people, or that there could have been a different approach in which it was less jarring, stressful, what have you, is pertinent to this conversation. On the other hand, I'm aware of a situation where a woman was with her child who was having a mental health crisis. The woman was living in the community that she had lived in for a very long time. But, you know, like you mentioned, being a parent does not come with instruction manuals.
Nope.
And people who think that they know how to parent your child, they're oftentimes just as confused as you are. They're just arrogant about it and won't admit that they don't know. It's just a stab in the dark, you know, and they probably being more nosy than not, right? So she, you know, is like, okay, what do I do? Okay, well, I go to the emergency room. The fact that people don't know what to do when they're in an emergency or who to call when something happens is a system that I think we should change, right?
Yeah.
Because we don't know when an emergency is going to happen, right? So there needs to be some preventative action that happens early so that when it shows up in your life, you know where to go. Because when her and her child sat in the ER for more than a day in a city that is known for having some of the most premier hospitals and healthcare systems, once they got to see a provider, the provider was not equipped to address the issue and asked the woman simply, well, if that's what he's going through, why'd you bring him here?
Come on.
That's so, I mean, I'm just saying, you know, these are the systems that we have to rethink, right? Because we've been tweaking them. We've been changing this little thing and changing that little thing. And yeah, okay, well, we hired some nicer police officers. Well, guess what? They're still showing up with guns and flashing lights. Okay. Well, we got this great healthcare system and all these awesome hospitals, but people in the community don't know how to access it.
Yep.
Right. And the people working in that world-class healthcare system don't know how to serve the people that show up in crisis.
Yep.
Right. And so we have these world-class systems. We have these multi-million-dollar, trillion-dollar investments in policing and this and that. But when it comes time to talk about, well, what about if we were to partner with and employ social workers or counselors or therapists or psychiatrists and use and offload some of that money that we've been blessed with from the federal government or our state or local entity, right? To have them partner, work alongside with, again, coming out of our silos, coming out of our circles and finding our center, finding our collective center. Yeah. And using those resources in such a way that we're sharing so that we can care, right? So that we can effectively serve the needs of our people who are our brothers, our sisters, our aunts, our uncles, our cousins, our friends. Friends are good too. And not seeing people who are going through a really hard time as the scum of the earth, something to be punished, you know, this lifelong label of once a felon, always a felon. Like, who does that?
Right.
Oh, you did this terrible thing when you were 22 years old. You've got to spend the next 30 years of your life paying for it. Like, what? I ain't even lived that long.
Right.
Well,
yeah.
I got to pay for it for longer than I've been alive.
Yeah. Well, and I feel like a lot of what we're talking about comes back to we all are humans and we have a shared humanity, and some of these systems and our culture and, you know, our media and other things are pushing us to view other parts of society as less than human. That's not the way we always think about it, but in reality, right, when you're labeling somebody a felon and you're kind of subconsciously thinking of them as a bad guy, that's what you're dehumanizing that person, right? In the case of the healthcare system, we see it, they're sometimes treating people not like they would treat their own brother, but they're thinking of them as this person has made poor choices. This person doesn't have the same, wherewithal that I do, the pride I'm thinking about. And so it's a sort of dehumanizing of the person. Whereas if we were more willing to give each other grace, acknowledge that all of us are flawed, all of us
Mm-hmm.
make mistakes, all of us make a series of good choices and bad choices, but our environment and our context shapes whether those choices have dire consequences or not, right?
Yes.
That is, a big shift that I think we need to be cognizant of the times ourselves, and I count myself definitely including this, when we're dehumanizing other people with our language or our viewpoints. And so much of our systems could be better if we actually saw every human in our society as an actual human that
Right.
deserves the same things we deserve.
Right. So we're getting into this space of deserving. We're getting in this space of resources, allocations, things like that. And some people say helping others is too expensive. People say, you have talked about expanding your imagination, understanding that there is an abundance, having an abundant mindset, but there is a lot of lack thinking. There's a
Yeah.
lot of thinking that's centered on there's a lack of resources, there are a limited number of resources and things like that. But for us, Paul, the way that we were trained, right, and the way that we are built is recognizing that sickness, poverty, and early death is even more expensive for everyone. So tell us a little bit more about, what you say, what your book says, what your research says about those types of things.
Yeah. And one other book I'd recommend on this topic is The Sum of Us by Heather
Mm,
McGhee. And it really talks about how racism in US society in particular, although I'm sure it's going to be true across the globe, but it harms all people. Sure, it has a disproportionate impact on Black people and other people of color, but that it harms the entire society. And part of some of the examples, I mean, the prime example that Heather McGhee gives in that is the fact that because of racism, there are so many communities across the country that don't have public swimming pools.
mm,
Because rather than integrate public swimming pools in the 50s and
mm.
60s, cities chose to just pave over their swimming pools. So that means that white people don't have swimming pools, right? Like, yes, it also means that Black people don't have swimming
Mhm,
pools, but that is the racism in that case, caused that community as a whole to have fewer resources.
mhm,
And there are, a lot of other amazing examples in the book. Some I also include in my book, but, you can trace also like our lack of social services, including, healthcare for all, to
mhm,
racism in our society, right? Part of it
mhm,
was a motivation to keep Black people and other people of color from receiving those services. So let's make it so that nobody can have these services.
mm,
And so it is, it's true that racism harms Black people and people of color more, but our society as a whole is less resourced and less abundant because of this disease we all have of, yeah, exactly. And
say it.
holding,
Disease.
yeah. And there's a definition of racism by Dr. Kamara Phyllis Jones.
Oh, I love her.
Yeah, she's amazing, one of my heroes. But in her definition of racism, she really highlights it's at the end of the day, it's the waste of human resources.
Oh gosh.
Right. And so to get back to your question directly,
Mhm,
what does it cost to help people? Oh, pennies compared to the cost it has on society to keep on harming people in the way that we do.
mhm,
Right? Our policy choices are causing so much harm to our communities, and it is wasting so much human resources. Think about the
mhm,
millions of people we imprison, right?
mm,
I mean, some of those people are brilliant. Some of
mhm.
those people are creative. Some of
Yes.
those people bring happiness to others, right? Like
Mhm,
there is an abundance of talent and resources in our prison population.
mhm,
And what do? we keep it locked up, and we pay something like, I don't have the exact figure, but something like $40,000 per person per year to do that. You could pay that is in some states an average annual salary, right? And so this argument of cost, on its surface, the cost of providing SNAP benefits, the cost of providing Medicaid, the cost of providing housing. Yeah, it does have a cost. That is true. And there are finite resources within city budgets and state budgets. All of that is true. But when you think about what we waste, harming people, and then the money we spend cleaning up the mess, right? So we are harming communities. I mean, a prime example of this is Flint water crisis, right?
Tell it.
They tried to save a few $1 million, ended up harming the whole community. It's costing hundreds of millions of dollars. I mean, much more than that, but in sort of direct costs, right? That was, just a direct policy choice.
Yeah.
And instead of investing in the community, right, because they were struggling financially. Well, why were they struggling financially? I'm going to get back to these root causes, right? They were struggling financially because of the economic policies that caused divestment in the city. It caused companies to have to leave. It caused, and then racism caused white flight, disinvestment. And then all of a sudden, Flint, Michigan, as a town, as a municipality, was struggling. And how did we as a society, in this case, the state of Michigan, try to solve that? Like, oh, let's give worse water. Let's make this decision, right?
No one will notice.
Yeah. They could have made an investment, right? They could have said, oh, wow, our past policies really made this city struggle. We should fill in the gaps.
Yeah.
Right?
Yeah.
And we are seeing some of that now. There are some good investments in the city of Flint now. There's some amazing work being done. Is it enough? Probably not, right? But the point being that it can cost so much more to stick with this punitive system. We're just wasting. I listen to economists and other policymakers talking about the economy, how important the economy is. Think about how gigantic our economy would be is if everybody had the opportunity to thrive and meet their full potential. How about that? Think about all the stuff we would be creating in our economy, how thriving we'd be. But instead, we hold back whole segments of our population. We don't give them the opportunities in school. We don't give them the opportunities. We force them to be resilient. So some do break through still, right? But many, the resilience isn't enough, right? Because the weight of the systems they're experiencing is too heavy to bear. So yeah, you got me going, but the cost question, it's again a lack of imagination. It's a lack of being able to zoom out and actually think about what are the ways in which we are causing harm, and we're actually paying money to cause that harm in a lot of cases.
Yes. Oh.
One more thing.
Go ahead.
Police take up 30 to 40% of city budgets, right?
Yeah.
We can imagine other ways to use that money.
Most definitely.
Other ways that also promote public safety. Other ways that help people thrive. And so when we have limited resources, we have to remember, we have plentiful resources. We are just choosing to constrain them in certain ways.
That's another wrap on Questions You Didn't Ask. I'm Niasha Frey, and it's been an absolute pleasure digging into these powerful conversations with Dr. Paul Fleming. We've got one final episode in this series, Beyond the Band-Aid. So don't miss the grand finale. subscribe, tell a friend, and meet me here